Hello friends, today I'll show you how to suspect which vitamins or micronutrients you might lack without tests, since it's easy to just get tested. But all of this costs quite a lot of money, so today I'll go over with you the main signs of vitamin and micronutrient deficiencies. What can you notice before you get tested? The thing is, most people find out about vitamin deficiencies, unfortunately, only when they already have some test results in their hands. But actually, the body knows how to communicate with us through certain external signs like losing nails or hair. And the only question is whether we listen to our body, whether we know how to communicate with it. But the body rarely stays silent. It actually constantly gives us some signals. And when it lacks building or regulatory substances, it doesn't break down like we think. It immediately starts to change its behavior. Every day, skin, hair, nails, mood, testosterone levels, libido, memory, sleep. Everything becomes different from what we're used to, and we become constantly tired, constantly irritated, and in the morning we wake up not feeling refreshed. This is the first sign that you have some deficiencies. And today, if you watch until the end, I'll tell you what you should pay attention to in yourself and possibly which deficiencies to rule out. The first is chronic fatigue, which unfortunately is the most common, and drowsiness. If we get enough sleep but still feel tired in the morning, we start to think that it's laziness, but in reality, it could be an iron deficiency, a deficiency of B vitamins or magnesium. Why? Because iron, for example, is responsible for transporting oxygen in the body. Without a normal level of iron, oxygen isn't delivered to the body in an adequate amount. And all our organs, starting from the brain and ending with the testicles, are in a state of hypoxia and begin to function worse. Vitamin B12, for example, is responsible for the functioning of nerve fibers, while magnesium is responsible for the production of our energy. Adenosine triphosphate, which is the energy currency of our cells. And when these substances are lacking in our body because you start eating poorly, or you start flushing them out of yourself, or you have some exam period, hard work, when you need more and don't change your diet, our cells start to starve at the mitochondrial level and we begin to feel it. But not as pain, it's a condition that we often describe as burnout. And for some reason, coffee stops helping, and it doesn't help because coffee doesn't give you energy, it just masks fatigue. And when fatigue is masked, there's no energy under that fatigue. Second point, it also occurs quite often, including among my followers. This is insomnia, anxiety, irritability, when a person goes to bed feeling tired but still can't fall asleep, just lying there staring at one spot, even though it seems like they should just crash and pass out. Very often it's not the nerves that are to blame, but a deficiency of magnesium, zinc, or B vitamins. Why? Because magnesium is critically needed to activate gamma-aminobutyric acid receptors. These are neurotransmitters that inhibit excitation, and zinc. It regulates the levels of dopamine and serotonin. Vitamin B6 is also very important for us because it helps convert tryptophan into serotonin. What do you think if we have a low level of tryptophan, if we have a low level of serotonin, how do you think you will feel? Well, actually, the answer is very simple. Your nervous system will lose its flexibility and your brain will stay in that mode. You've likely heard this before, fight or flight. Even at night after you've gone to bed, your brain stays active. You're always in this state, only your activity and sleep patterns shift, causing your sleep to be shallow. You have constant anxiety for no reason, and in the morning, instead of waking up feeling fully recharged, you don't feel that way. The third point is that women often describe dry skin, cracks, especially in the corners of the mouth and on the lips, and hair loss. The epithelium is our skin. It's the first tissue that suffers from a deficiency because it's visible, it constantly renews itself, and we constantly see and feel it. And we try to deal with it using some creams or shampoos. But in reality, if you have dry skin, flaking, or early wrinkles, it's very often simply the result of a lack of vitamins, specifically a deficiency in vitamins A, E, zinc, or biotin. If you have cracks in the corners of your mouth, skin folds, or sores, that's a classic sign of a deficiency in vitamin B2 and iron. So when I see someone constantly applying cream here and they have those sores, I know it's about vitamin B2 and iron. Women often complain that their hair is falling out or becoming thinner. This is an important signal, and it's not about switching your shampoo. So pay more attention to your nutrition, because it could be low ferritin, low zinc levels, low selenium, or possibly biotin. A common reason is not getting enough protein. People diet without considering protein and end up lacking it. Therefore, pathological processes begin in the body. And if your hair is dull, brittle, and grows slowly, by the way, it's the speed of hair growth that changes, not the amount, but the speed. For example, you used to visit the hairdresser more often, but now you go about half as often. That means the body is conserving resources, it's redistributing them to more important systems, towards the brain, the heart, and the liver. That's why we first notice the suffering of the epithelial tissues. Beauty is a luxury for the body, and when it lacks basic elements, you start to look worse. And why? When people used to choose a bride, did they look at her hair, nails, and teeth? These are signs of a healthy body, so don't look at the shampoo, but think about what's causing these problems in your body. The fourth point is an illness. There were such symptoms as fainting, convulsions, muscle twitches, and numbness. If you notice that at night you suddenly grab your calf because your calf muscle cramped, or your eyelids or fingers twitch, and in 80% of cases magnesium is to blame, less often calcium or potassium, but mostly magnesium. It is very important. It controls the balance of sodium and calcium in muscle cells. And when it's lacking, the channel stays open and the muscles receive extra signals to contract. Numbness, tingling, especially if you feel it in your fingers, may indicate that you are lacking B vitamins, especially B12. That's why I often notice this in vegetarians and vegans. B9 also plays an important role here. This is folic acid, especially if it is accompanied by weakness and difficulty concentrating. All of this, if you've noticed it, then think about whether you're eating enough meat in your diet. Fifth, a common complaint. Doctor, I get sick often. I'm constantly sick. As soon as I go outside, I get sick right away. Everyone around me is fine, but I get sick. Maybe I need some kind of vaccine, or maybe something else, or maybe some medicine. Remember, if a person gets sick like clockwork every winter as soon as they get a little bit cold, the cause is often not catching a virus or missing vaccines, but lacking vitamin D, zinc, or selenium. Vitamin D regulates lymphocyte activation, zinc supports the thymus, and selenium protects immune cells with antioxidants. Even a mild vitamin D deficiency can lower resistance to infections by 30 to 40%. So when it's cold and sunlight is limited, increase vitamin D in your diet and take an extra 2,000 units daily. I recommend this for everyone. And that's why people with low selenium levels tend to have more severe viral illnesses, for example. You'll get sicker, recover more slowly, and face more complications. Because it's easier for the virus to multiply in cells with a weakened antioxidant barrier. Thinking, since I'm already sick, I'll be sick for a week anyway, isn't true. You can come out of an illness with consequences, so keep an eye on your antioxidant levels. Point 6 probably is slow wound healing and bruising for no apparent reason. You bump into the corner of a table or catch yourself on something and immediately you get a bruise. We all have people like that around us, so let them know and have them watch this episode, because this is one of the most accurate external signs of a deficiency. If your skin heals slowly or you bruise without injury. You playfully pinched your girlfriend, but she got a big bruise. Look for vitamin deficiencies, primarily vitamin C, zinc deficiency, and protein. Vitamin C supports collagen synthesis, zinc aids cell division and tissue repair, and protein forms our body structure. And that's why if you see this, it's more common in girls, please recommend that she takes some vitamins or add some vitamin-rich salads. Otherwise, none of this functions in the body. That's just how we're made, unfortunately. There are animals that can feed only on vines or, I don't know, eucalyptus, but we're not built that way. 7th point, this is important for school children and anyone who uses their brain a lot. Many struggle with concentration, focus, memory, and motivation. Yesterday at work, my friend asked, how do you cure attention deficit hyperactivity disorder? I replied, we're about to discuss this now. If you suddenly notice that it's become hard for you to keep your focus and your mind just starts to drift, your memory has become short. It might not be RILS or attention deficit hyperactivity disorder. These days, everyone talks about attention deficit hyperactivity disorder constantly. And iron, B vitamins, iodine, and omega-3 iron. It's not only needed for hemoglobin synthesis, but also crucial for neuron function, as it helps make dopamine. And if a deficiency occurs, you'll understand after this episode that it's as clear as 2 plus 2. The basics work in every organism. If you fall into a deficiency, a person loses interest in what used to excite them. For example, iodine is very necessary for our thyroid gland, and its hormones are ours. They determine the rate of metabolism in the brain, and when a person has a thyroid deficiency, the brain even develops what is called cretinism, meaning the brain starts to function very slowly. And that's why if you see that your child is falling far behind in school, maybe he really is lacking something. For example, iodine. Omega-3 is also lacking, and since it's vital for building membranes and neurons, low levels slow signal transmission, causing reduced mental sharpness. That's why a good parent, when noticing their child has concentration or behavior issues, focuses on possible deficiencies rather than just upbringing. The 8th point probably concerns women more at its menstrual cycle disorders, and for men I would say it's libido. Yes, I would put libido here because our endocrine system is not a one-time thing. I've said before and I'll say again, it's a litmus test, an indicator, like a dashboard warning light. To synthesize hormones, you need fats, zinc, selenium, iodine, and vitamin D. That's why I often recommend eating eggs, for example, because they contain a lot of these nutrients. When this is lacking, the brain doesn't receive the needed signals. And about the fact that it's ready for the body to work at full capacity, reproduction, libido, and everything else, these things only start working when all the processes in the body are functioning properly. That's why in all stressful conditions in besieged cities, during periods of severe hunger, women lose their cycle and men lose their libido because the body isn't concerned with reproduction or offspring at that time. Currently, its main focus is survival, causing men's testosterone, interest in life, and interest in women to decrease. The 9th point is craving sweets, and overeating is a scourge of modern times because if a person is constantly reaching for sweets, we tend to think it's a weakness of character. In reality, there is often a biochemical imbalance behind this, and a common reason is a deficiency of magnesium, chromium, and also protein, and the brain demands glucose. We often crave chocolate, we snack on chocolate bars, especially if we're under constant stress. But in reality, you actually want magnesium. If you restore your magnesium levels, you won't crave it as much. You may think you want sweets, but sometimes you don't. If you boost your magnesium and protein, your sugar cravings often decrease on their own. So when girls or guys come to me and ask, well, how can I stop craving chocolate? Start taking magnesium, get enough protein, and you'll see a miracle. Because cravings for sweets come and go. Sometimes you have them, sometimes not. And here's a simple explanation. The 10th point is your mood. I would probably say that the emotional aspect is a very important thing here. Deficiencies can mimic depression, and low B vitamins, folic acid, zinc, magnesium, and omega-3s lower serotonin and dopamine. A person becomes sluggish and apathetic. A psychiatrist leaves thinking it's depression, but in reality, it's a biochemical deficiency. The brain also needs all these substances to function properly. And when you go to a psychiatrist, do you think the psychiatrist will send you for tests? No, they'll never order tests for you. They'll just prescribe antidepressants. That's why I have nothing against colleagues who prescribe their medications within their area of jurisdiction. But we often see people who have not addressed basic deficiencies, who have low testosterone, for example, or problems with their thyroid, and they're prescribed antidepressants. How should all this be checked? If at least 3 of these signs match you, that's already a signal that you should think about doing some basic diagnostics. Let's try to break down what's included in the minimum. Complete blood count, ferritin, iron, vitamin D, B12 folic acid, magnesium, zinc, selenium, thyroid stimulating hormone, and probably glycated hemoglobin and glucose. This is really the absolute bare minimum that you probably won't be refused if you insist on getting it done at the clinic. These are 10 indicators that explain 90% of the chronic complaints that people go to doctors with for years. If my episode resonated with you, write in the comments what signals you notice in yourself. maybe I'll give some recommendations. And by the way, I have a link in my Telegram to a free, absolutely free bot that helps with diagnostics and suggests which tests to take. So check it out, use it, and stay healthy. Don't get sick.